We're going to talk about mindfulness today, use some skills ourselves and build those skills as we use them and learn about them. The topic in particular is mindfulness in challenging times or mindfulness in crisis. There's a lot to be said, I think, about mindfulness. And the reason I love this subject is I can see that it benefits a lot of people and it's benefited me in my own life and in my own practice. I'm a licensed clinical social worker. I've been practicing in the field for 7 years, nine, I guess, if you include my internships, depending on who you ask, you should or you shouldn't. Um, I really enjoy it. I can see that all types of mindfulness really benefit people. And I think we hear the term so much, it starts to become almost like dead weight in our mind. That you hear mindfulness, you kind of attach that term to whatever mindfulness has meant to you or whatever mindfulness has most recently been attached to, and then we kind of forget it or we just assume there's nothing else to it. So I think it's useful to take additional perspectives to touch base with what mindfulness can be at different times. So let's get started. So let's begin with the basics. What is mindfulness? The definition that I chose for today is a simple one, that mindfulness are the different skills that we use to accomplish this goal, paying attention in a particular way on purpose in the present moment and non-judgmentally. This is derived from a definition from John Kabat-Zinn as well. It's a common definition for mindfulness. We can think of this as really the core purpose of mindfulness and why we see so many versions of it. We're probably most used to thinking about our breathing, and it's a useful thing. It's a very common experience, right? We're all breathing in some way. The way that we breathe, the frequency that we breathe, the depth of our breath, whether we like to hear our own breath or not, is all different. So how we like mindfulness or if we like mindfulness when it's a breathing practice is sort of up to that individual person. But really the purpose isn't about your breath exactly, it's about paying attention. So we use the breath as a focus for the attention. You can really pay attention to anything as long as you're getting practice with things that focus your attention or that tell you something about your attention. And we're doing this as a practice. It's on purpose. We're doing it repeatedly. That's why we call it a practice. There's no perfection, no perfect version of it. Um, we are going to be in the present moment. We're trying not to be pulled into the future or into the past. We're attaching just to, or we're paying attention rather, just to what exists right now, not what isn't really there. And we're not going to apply any judgments to it. So nothing is good or bad, it just is. We can think of mindfulness as being an equal sign, that when we apply a concept of acceptance to something, that I'm saying, this is what it is, this situation is what it is. And I'm not saying, well, it is what it is. What can I do about it? Who cares? I'm saying, it is what it is. I may not feel good about it. I may feel great about it. I may feel horrible about it. I can feel really anything I want to feel about it. My emotions are something I can pay attention to. But what I am saying is, I'm not in any level of denial about it. I'm going to do my best to avoid denial or distraction from the moment and just be in that moment. Allow whatever it is, even if it's painful, to be. So let's define a crisis just briefly. I think we are all pretty familiar with it, right? Regardless of what we do with our day to day, we are experiencing one right now, and it's been ongoing, which can feel pretty unusual. It has multiple definitions. There's actually some standards we can look to. So, the Joint Commission Panel for Mental Health does offer multiple definitions and acknowledges that crisis is subjective. It depends on a person's experience of crisis. It depends on our assessment of the situation. So if we're looking at a situation and we say, this is not a crisis, that doesn't mean that it isn't a crisis for the other person, right? So if that person is going through a difficult time, a challenging time, is very emotional about something, or maybe they're not emotional about it. They think I'm totally fine, but we can see that they're in a high risk state, a high risk situation. They may lose their house. They may, um, be in a situation where they no longer have the same money, that kind of thing. And some of these situations are happening now with the crisis that we're in. We have to take kind of multiple perspectives on what a crisis can be. So we can allow that subjective thing to guide our definition of what crisis is. And that's one of the things that I think I enjoy about mindfulness, is that mindfulness doesn't get rid of subjectiveness or subjectivity, that we can be in a situation, that situation can have subjective qualities to it. Our perspective is still important. It's a part of the present moment. I can look at a situation and say, I think this is a crisis, or for me, this is a crisis. And I can allow both my experience of it into the moment and an objective view into the moment, and they can both be there. I can accept it, they can be what they are, and I don't have to be guided or forced to view it in a particular way. I can just allow things to be as they are. We're going to talk about what that really means. So, in a moment of crisis, whether it is a crisis like a car accident, or if it's a crisis that may be ongoing, like a natural disaster or a viral outbreak, we have a lot of things that we might experience. So, emotionally and physically, we could experience things like anxiety, these racing thoughts, this sense of persistent worry that feels maybe out of control, that we don't know that we can tell our thoughts what to do. Dissociation. So feeling like maybe we're not present in our own body. And that can be a total sense, like I'm not in my body, or I'm not sitting in the chair I'm sitting in right now. Or it can be partialized, where sometimes people experience this sense that maybe they can't feel their wrists, or I can't feel my hands. Sometimes you may hear people say, and not because they're under the influence, but because they are feeling dissociated from part of their body. That's one of the reasons that people use things like grounding techniques. We tell people to put their feet on the floor, feel their feet on the floor, because in that moment, they really don't have a sense that they're attached to the ground and to their body, feeling like they're out of control, like they don't have the ability to be in control of their lives. And it may be in this situation that there are things that they can't control, right? There are things in this situation that we do not have control over. We don't have control over the development of a vaccine, let's say, when that vaccine would be ready. We don't have control over other people and whether or not they wear a mask, whether or not toilet paper will be on the shelves. But we can have control over things like, do I accept the situation as it is? Can I acknowledge control over myself and my reaction or response to it? Can I acknowledge that I'm allowed to have these feelings that I have about it, and that I can't control, if there's toilet paper on the shelf, but I'm not going to try to control that thing. I'll just control what I can. Trying not to have denial, even though maybe we're going to experience denial. We might feel faint, having trouble breathing, these physical responses. We may be startled more easily, having another physical sense. GI distress is very common. Stomach issues are big. And with what's going on now, it's not uncommon, especially in the early stages of this. Many people that I spoke to were concerned about their GI distress because they thought it might be a symptom. Loss of focus is big too, and memory issues can come up a lot in a crisis because our brains are scattered. We're all over the place. So with mindfulness, we often are spending time sitting with ourselves. We might consider, especially with a deep mindfulness practice or with a long meditation, that we're sitting in silent contemplation. And that's not always a bad thing, but it's not always a good thing. If we have a history, let's say, of trauma, if we have struggled with a recent trauma or a recent crisis, and we don't know that we have the tools right now to deal with it, that we can't sit with the, let's call it the bald emotion, the raw emotion of that thing, It may be very hard to just be present with that feeling and that emotion for a long period of time. So, what we might traditionally think of as mindfulness, kind of sitting in stillness for 20 minutes a day. I hear that a lot, that, we should sit in stillness for 20 minutes and we should focus on just our breathing, that's a mindfulness practice. And it can be. But that may be really hard when we're in crisis. We're very distracted. We're feeling really anxious. I don't maybe want to think about it for 20 minutes. So that silent contemplation might give too much room for our experiences of anxiety and trauma to resurface. I can certainly, let me go back. Someone wants to see the symptoms again. I'm just going to pop back to that slide. I can also, I believe, send these out to people. There should be a way for me to check in with people who signed in, although I'm not sure if I'm able to get people's email addresses or not. I think if you used an email address to sign up for Zoom, then I can send it to that email address. We don't have registration turned on. I wanted it to be easy as possible for people to get in, so I can send slides to people as a PDF. So what we do have an opportunity to do is still mindful and still mindfulness. Sometimes I like to refer to this with a new phrase, and I joke with my coworkers that I'm like the branding machine, that I'm always trying to come up with a new way to refer to things, but I don't like to come up with brand new words. So I like to call this one Zen, and that's old terminology, Zen mindfulness, that we are using brief mindfulness skills. So in a crisis, we are taken away from our present moment. We're taken into the realm of fear, anxiety. We're being irrational. We can use mindfulness skills and brief mindfulness skills to find a sense of what it means to be in the present, to just do returning to the present. When my focus is shifted, remember that mindfulness is a way of practicing directing our attention. So when my focus is shifted, I can redirect my attention just to being in the present. And if a difficult thought or a challenging thought comes up, I can label it and let it go. I don't need to be stuck with that thought. And if it's too much, if it's too overwhelming, I can get up and do something else. And there's some brief mindfulness skills that won't ask me to sit with my thoughts. And that's okay too. I need to have ways to be mindful without feeling stuck. I can really use mindfulness to create a safe place and a safe environment, especially when I don't feel safe and secure with what I have going on right now. So let's talk about how we can do that. There are a lot of really great skills that come out of a type of therapy called DBT. They use a lot of mindfulness. And so I want to share some of that with you and also provide you with some opportunities for mindfulness. So DBT talks about distress tolerance skills. And I think we can relate to feeling distressed. I've certainly felt distressed in the past 6 or 7 weeks, right? One of the big topics in that is acceptance. So the idea of acceptance, and especially radical acceptance, is refers to this idea of letting go of fighting a moment. And what that means is a reference really to a Buddhist concept of suffering. And that suffering comes out of not accepting a moment and of fighting what is. So let's say I am, and this would be a really understandable reaction to have, right? That I am frustrated with being stuck at home. Totally reasonable emotion. I'm angry, I'm upset, whatever, with being stuck at home. So, from this perspective, we experience suffering not because of being in our situation, not because of all these other things, and you'll hear echoes of other sentiments, right? Like stress isn't the situation; it's our reaction to the situation. So, with radical acceptance, it asks us to say, I'm in my situation, and that what I can do right now is try not to fight it. And that doesn't mean letting go of our ability to do other things, letting go of our ability to find sense of control in some other way. But if I find myself directing a lot of my thoughts and energies and feelings into finding a way to be outside or searching the internet constantly and being engaged with the news 24/7, maybe literally, I'm getting news updates, let's say, constantly, 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 because I can't wait to find out when I can really be out of my house without a mask. So if that's what is predominating my thoughts, then I need to recognize that that is me fighting my situation. I am fighting with reality, and that creates a sense of suffering. So that suffering I can't tolerate. I can't deal with that. That's going to be a constant struggle. But if I'm in pain because I feel isolated or I feel that I can't be where I want to be, I can process pain. I can deal with pain. We are human creatures that have emotions, and pain is a part of life. It's okay to be in pain. I can sit with that pain, process it. I can talk to people who have that similar pain. I can express that to them. I can be artistic. I can sit and feel that pain, cry, I can let it out, and then I can let it go. But if I'm fighting constantly, I'm just going to be suffering. There's actually a mantra that I will use sometimes that sounds funny when you don't know this concept, or it sounds strange when you don't know this concept, which is stop fighting. There's nothing you can do. And it sounds almost scary, but I say this to myself, and I say, when I am feeling a sense of suffering coming up, or I am really fighting against my environment, I will sit and I will take some deep breaths and I will say, stop fighting it. There is nothing you can do here. And what that allows me to do is it reminds me to say, if I'm devoting this energy in my life or in my situation towards something that I really can't change or that I really can't do much about, if I'm really fighting reality here, maybe I can just breathe and say, okay, with kindness and compassion for myself, can I let go of this fight? And can I instead turn that energy towards caring for myself? Because what this means is I'm in pain. I'm fighting because I'm in pain. So can I do that instead? And we call that turning the mind. So let's choose to accept what's going on and turn the mind. Think about it as turning the mind towards yourself. There is a another idea in this DBT concept called improve, and this is kind of a brief mnemonic device that helps you remember a couple ways to change your thought patterns. So improve stands for imagery. So thinking about a peaceful and positive place, just shift your thinking away from the stressful thing that's going on right now. And what I like to do is think of the most enjoyable, the most positive, the best place that you've been. For a lot of us, it's the beach. For some of us, it's a vacation. And really, just what is the best thing about it, and what is the emotion that came up in that moment, the positive emotion there. Meaning, so creating or finding meaning from this challenge. What is the lesson that we can gain from this? How is this something we can weave into the narrative of our life that we are gaining some positive from this? And this is a really a hallmark of resiliency as well. If we are fighting the moment and not creating a sense of kind of almost reward out of the struggle, then we're not really gaining from it. And if any of these are ones that we think, I'm not going to find meaning out of this, or I can't think of it of my vacation without feeling negative, then those are ones that we just don't do. That's okay. That's why I like that mindfulness is fairly diverse as a skill. We can use the ones that work for us. And sometimes later we find additional ones work. Prayer and practice, which means using the thing that we have faith in, a skill, or when we think of practice, a positive habit. It can be art, it can be music, it can be going on a walk that really reminds us to invest in ourselves, doing something relaxing, which we're going to do in just a moment, uh, practicing on just one thing. Mindfulness is often just doing one thing in the moment. It could be writing something, it could be using like fidget cubes. So I really enjoy fidget cubes for mindfulness. You could practice on one thing in the moment. I actually have this fidget, maybe hard to see. I'm going to actually make the screen bigger so you can see just me, and I'll go back to it. This is a little pea pod. It's a keychain. And when you squeeze it, a little pea comes out. And the idea is how you use this for mindfulness is when you are feeling stressed or anxious or you need to change, turn your mind, you focus just on this feeling of you put your pressure and energy here and you just push, and that's all that you focus on is just this one sense. And that's a great way to think of focusing on one thing is pick a sense. If there's, let's say you're baking or you're cooking, cooking is a great practice. Focus on just the sense of smell. Focus if you're eating on the sense of taste. Focus on one thing you can see, or focus on a feeling like this little pea in the pod. So let me share that screen again for you. Here we go. Taking a vacation, getting away from this moment. So, not physically going anywhere, but getting away from the moment that's stressing us out. And then being our own cheerleader or calling in a friend to encourage us in a moment where we're having trouble. So, I want to make sure we have a little bit of time to do some mindfulness practice. This is another skill I'm going to send to you. It just reminds us similarly to do some things when we're in crisis mode for survival. And then there's something called the raisin exercise. So I want to describe this to you, and then I'm going to do a brief meditation with you guys. The mindful eating exercise is another alternative to regular mindfulness. John Kabat-Zinn talks about you doing this with a raisin, and it is a kind of longer mindfulness experience, but it's active and engaging. So you take a raisin, and instead of the regular way we would eat a raisin, you just pop it in your mouth, you eat it, you don't really think about it. We eat this way a lot of the time. Everything from taking the raisin out of the package to looking at the raisin to feeling it, putting it up to your mouth, in your mouth, is a long and drawn out process where you're experiencing every small part of that. And we are really focusing all of our attention on the process of eating. So there are a lot of kind of enjoyable and engaging ways to practice engaging and directing our attention that don't necessarily involve engaging and directing our attention on the crisis at hand. Mindful eating is also a great way to eat chips if you are eating too many chips, which I have done myself, because if you eat chips really slowly, let me tell you, not super fun. Makes you not want to eat so many chips once they get super soggy and you're holding them in your mouth, because that's part of the mindful eating practice. So, I want to guide you through what is called a self-compassion and positive reinforcement meditation. This is one that I wrote myself a few years ago. And what I'm going to ask you to do is just, you can close your eyes, you can have your eyes open. Some people like to do what is called a dull gaze, meaning looking nowhere in particular, out at the middle distance, to help you, whatever is most comfortable, to not focus on anything in the room, but just to listen to my voice. You can do what I'm describing or just kind of listen as I read a brief meditation for you. So, to begin, find a comfortable position where you feel well supported and relaxed. Perhaps sitting in a chair with your back straight but not tense, or lying down with your full body supported. Adopt a posture of relaxed attentiveness, mirroring in your body the state of calmness and observance that mindfulness can bring. And when you are ready, close your eyes and bring your attention to your breathing. Notice all the sensations associated with breathing. Perhaps you notice the feeling of air as it enters your nose or mouth, or as it leaves. Perhaps you notice how your breath feels in your throat or lungs, the rise and fall of your abdomen as you take deep, relaxing breaths. Take a few moments simply to dwell in this stillness, noticing the breath without trying to judge or change it. There is no good breath or bad breath, no right or wrong way to do it. And when you find yourself getting distracted, that's okay. Try to gently bring your attention back to your breathing, back to moment awareness of these feelings. You may acknowledge the distraction and without judgment, turn your attention back to your breath, allowing the distracting thought to float away and dissolve. As you breathe, notice any places in your body where you are holding onto tension, and without judging or directing negative thoughts and energy to these places, try to relax them one by one. Notice if there is any pain or tension in your shoulders, and with your out breath, try to release the pain and tension, allowing these muscles to relax. Notice if there is any pain or discomfort in your hands and your arms, feeling where daily movement may have built this tension, and allowing these hard-working muscles to relax. And breathing in and out, directing your attention up to your face and your jaw, unclenching and relaxing these areas, allowing the gentle pull of gravity to soften the muscles and bring calm. Bringing your attention to your neck and to your back, noticing where these sturdy supports have gathered tension, and showing yourself compassion, allowing that tension to lessen and release. And now, bringing your attention to your legs and to your feet. Again, noticing where hard-working muscles have built tension and stress, allowing them to relax and recover as you show yourself compassion and kindness. Allow the tension in your body to fade and melt away, continuing to breathe in and out slowly and calmly, allowing the calmness to build on the in-breath and for tension and pain to flow away on the out-breath. In this relaxed and mindfully aware state, you can now direct to yourself the loving kindness that we all as humans need. Showing yourself compassion and kindness, listen to and begin to repeat these words, allowing the gentle repetition and affirmation to soften and de-stress your mind. May I be well. May I be confident. May I be safe. May I be free from anxiety and fear. May I be positive. May I compare myself less to others. May I be deliberate in my actions. May I be filled with loving kindness. May my heart be stable and full of love. May I be calm. And continuing to repeat those phrases that restore and complete you, that bring relaxation and positive growth to you. Continuing to breathe and repeat, may I be well. May I be confident. May I be safe. May I be free from anxiety and fear. May I be positive. May I compare myself less to others. May I be deliberate in my actions. May I be filled with loving kindness. May my heart be stable and full of love. May I be calm. And so, taking the time you need and deserve to care for yourself and to wish yourself well, practicing the love, kindness, and compassion that can heal and restore. And as you return to the room, thank yourself for taking a moment just for you. So that's an example of a brief meditation that builds some mindfulness skills, but is also a bit more of a guided meditation. And there's lots of resources for things like this. Calm is one example as an app. They have a really great YouTube channel. 10% Happier as well. Stop, Breathe, and Think. They all have some pretty good resources in that direction. But I really encourage you guys to explore mindfulness as an option for relaxation, for de stressing. There's also a fun skill called Zen Tangles, where you take a couple moments out to basically draw some repeating patterns within a shape. And that's all you really do. Instead of focusing on your breathing, you draw a little shape. You can divide it up if you like. And then in each of those little shapes or dividers, you draw a repeating pattern, whatever pattern you want. And that's all you focus on. And you allow your mind just to focus and settle on that. It helps direct your attention. It takes you away from the crisis in the moment. I want to thank you guys for joining me today. My name is Adam. I'm the Director of Programming at the Long Island Council on Alcoholism and Drug Dependence. We have been serving the Long Island community for 64 years, and I really, really appreciate you guys taking some time out today, most especially for yourselves. Thank you guys so much, and please, please, please take care of yourselves. If you need any help or support, we're always here for you. We have a 24-hour hotline in Suffolk County. That number is 631-979-1700, 631-979-1700. We are all licensed healthcare professionals, so we are happy to provide telehealth services and counseling. We are never refusing anyone based on ability to pay. So anything we can do, you can just let us know. Thank you so much, and please take care. You have a good evening, guys. Bye.